Welcome to the Healthcast, where we explore the intersection of healthcare, technology, and business innovation. I'm Phil Zappone, family nurse practitioner and founder of NXAI Growth Consultancy. We help healthcare companies grow with AI and automation. On this show, I speak with founders, clinicians, and innovators who are building the future of healthcare. Today on the Healthcast, we're exploring how adult day services and community-based care are reshaping aging, caregiving, and patient outcomes. I'm super excited to sit down with Tia Sauceda, Executive Director from the National Adult Day Services Association. Welcome to the show, Tia.
Thank you, Phil. I'm so glad to be here and thrilled to dive in.
I feel like we chatted before, and I feel like you have a really interesting career journey. Tell us how, as from a young person to where you are today, tell us how you got to your role.
Thank you. Yeah, I started in adult day services in my early 20s. I was studying in sociology, and I had at one point wanted to be an art teacher and kind of was not exactly sure where I wanted to go. And I happened upon a woman who was doing activities for older adults in a facility. And I genuinely just thought that has to be the greatest job ever. And so, much to the dismay of my parents, I opened the phone book and found an adult day center and started working there just a couple days a week. And I will tell you, within probably 4 months, I was hooked. I just thought this is the very best place to spend my day, a great way to have a fun job, but more importantly, I was having an impact that I needed, I think really deeply in my life at the time. And so I started as an activity coordinator doing direct care, and through the course of years, I opened day programs, became the director. I've run day programs of all sizes, really large centers to small centers. Most of my experience, I think, has been really in the older adult space, specifically people living with dementia. But I did run a day program for individuals with disabilities for a period of time in my career. And I will say, for me, it was just like this amazing strike of lightning, right? Like, some people, I would say it's a luxury to do what you love. And I've been so lucky to be able to do what I love my whole career. So Adult Day is just, it's who I am. And in the last few years, I got involved with NADSA more closely. I became, a member of their board of directors. And when the opportunity came to be able to, throw my hat in the ring for the executive director role, I had to take it. And I feel like this is where I'm supposed to be. And I'm just really excited to now be having those bigger conversations that will impact Adult Day on a national level and take what I love and what was always at my core and take it to the next level.
Yeah. I love that story. I love hearing the phone book reference.
Yeah.
We both joked about that before.
Thank myself.
And then, yeah, right. Me too. And then I have had a convoluted career journey and love what I do today, but it's taken me a long time to get here. And I was always jealous of people. Like, you hear about somebody who's like, I want to be a pilot, I want to be a doctor, or somebody in your situation who finds their calling and or a connection at a young stage. So that's really cool. And still passionate about what you're doing. So
more than ever.
to you.
Yeah, thank you.
Tell us for those who don't know. Tell us what National Adult Day Services Association, what they do, what's their effort.
Sure, yeah, and in healthcare we love our acronyms, so I will refer to it as NADSA, but it is the National Adult Day Services Association. And what NADSA really does is it connects adult day providers across the country. So I always say your best quality is your worst quality. And the beauty of Adult Day is that we are so individualized. Every center is really different. That's also our challenge, right? Every center is different, and every state does Adult Day differently. And so NADSA really feels like the way to close that gap, right? So we provide education, we provide a policy and advocacy around some of the big issues that are facing home and community-based services right now. And we really feel like we bring Adult Day to that higher standard, if you will. There are thousands of Adult Day centers across the nation, and I think that it still remains that best
Sure.
kept secret. And my job is to shout it from the rooftops to make sure that it is no longer a secret and that we are utilizing this service within our communities. And so NADSA's role is to really elevate that.
Was there a personal or professional moment that shaped how you view the role of community-based care in supporting older adults and families?
Yeah, I mean, I think like most people, I have a family connection. I always give kudos to my mom. So my mom was the youngest of eight, and she was the primary, she was the caregiver for both of her parents. And fortunately, they didn't, have Alzheimer's or dementia, but they were on hospice at their end of life. And I watched her, at a very young age. She was in her 20s when this was happening, step in as caregiver. And then I continued to watch her do it for siblings. As the youngest of eight, you kind of get pulled into different roles that maybe you didn't know you were going to get pulled into. And so for me, really seeing that firsthand, and then as I grew in my career, seeing the impact that this had on the caregiver, it was like a bonus, right? Like I love the participants and I really believe in providing quality of life and opportunities to connect and be cared for. At the same time, we're able to really care for that caregiver. And so it's like you get the two for one, and often it's more than two because there's a whole family of caregivers or a family of choice. I think for me though, that was what really connected me really early on, was this piece that I loved my grandparents. I was really close with them. So I always liked older adults. I liked to hear their stories. And I always say I learned everything I need to know from someone in adult day. Like I learned how to make a pie. I learned how to raise my kids. I, learned how to probably do my taxes, right? Like they have so much wisdom, and it really became just my education within the adult day space. So there's so many there's so many I could point to, but that's probably the big one. Yeah.
What's that expression when you? It's like when you like someone like volunteering. Sometimes you get more than you give. And it sounds like you're able to reap a lot from your effort at work. You're able
Yes.
to internalize and take away a lot of key lessons and love and support. It's great.
No, it was the greatest education I could have ever had.
I love that summary. How has your understanding of patient outcomes evolved over your career?
Sure. I think in the beginning, right? Like I was just happy people were having a nice day. I mean, right? We were happy that we were providing them a
Yeah.
place to come where they got a nice meal. They, maybe saw the nurse. It started for me as a nice to have, like, oh, this is really nice. And as my career grew and I got to meet the experts in the field, I was just on a call with NADSA's research committee, and really dedicated to studying the outcomes of adult day. That's what excites me now, right? So yes, all of that wonderful stuff still happens, and I don't want to minimize that in any way, shape, or form, because we still need connection. No matter what age we are, no matter what diagnosis we're living with, we need connection. We need that piece of it. But in addition to that, we get extended time at home, right? So we're keeping people out of nursing homes, we're keeping people out of more restrictive care by providing them with day-to-day oversight, so help with their nursing medication. Like if you just think simply medication management, right? If someone is able to make sure that they take their medicine on time, not only does that impact their diagnoses, but it also potentially stops a fall, it potentially stops an infection. It's all of those other pieces of the puzzle that come together that make a whole person. So adult day outcomes started as nice to have, but I think that they've evolved into really substantial health outcomes, right? People are able to stay living in their homes. People don't progress in their diagnosis as much. I can't tell you how many nurses I've worked with that have, caught a stroke or a heart attack as it's happening. And if that person had been living at home, that probably wouldn't have been caught. And they then return to adult day within a week. Food is medicine, right? So having a meal every day that is a nutritious meal where you're sitting with your peers, that is something that keeps people healthy and going. And so, I mean, believe me, there are the statistics. I'm not the walking statistic. I'm terrible about remembering all of those things, but I can tell you that it has evolved greatly over time. And adult day is no longer a nice to have. It's not a part of the fringe. Like, it is a core service within the communities that are keeping people living at home, and it's the lowest cost of care. That's the other piece I think that, we need to make sure we're talking about in a world that is, constantly the cost of care is being discussed, and we all know it's outrageous. Adult day is the lowest
Hmm.
cost of
Hmm.
care. It's still, you get the most for your buck, if you will, with adult day, both from from a government reimbursement point of view and a private pay reimbursement point of view. What you get from adult day
Yeah.
is so profound.
I'm gonna add one thing that I feel like something that I'm learning as a podcast host of a healthcare. The term healthcare is just really broad and encompasses lots of different specialists and avenues, and this web that we all share of. Hopefully, we hear a lot of negativity, and you can't even watch the news these days. But the
Yeah.
web of people looking out for others, whether it's on the front lines, whether it's your role supporting the older demographic. And I really liked what you said about the value of a warm meal with your amongst your peers, creating a sense of community. I heard affordability, and I think I also heard in there just providing a sense of purpose and value. And I think something that speaks to me personally is a value I really like and try to harness is self reliance. And so Adult Day helps keep people in their homes and
Mm,
provide some support structure so that they can maintain their self reliance. Is that fair to say?
yes. 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 Yeah.
Maybe I think you and I touched upon this last time too. Maybe often overlooked too. It's not just giving the meds, but it's the human, and the warm meal. Fantastic. I'm a big eater myself and love delicious food, but the effort and the intention behind it, I think, is what you're saying, and
Yeah. I
that's
mean, if
somewhat
you think about the
immeasurable.
meal, sorry, but if you think about the meal, right? If I'm a
Go.
caregiver and maybe I've got to take my kids to soccer practice and I've got my mom staying with me, I'm going to put a sandwich down in front of her and probably do 17 other things. I'm not going to sit and have a meal with her. Whereas in the adult day center,
Yeah.
that is what's happening, is it's real community being built. And so I think, you can't make that somewhere else. Like, real community is something that we all need to thrive. And, again, I think adult day gives both parties something that is theirs. The participant has that day out where they're getting the care that they need, but they're also getting the interaction and the socialization, the connection. And the caregiver, they get to go just do what it is they need to do, which often is go to work. But, I mean, if you look at it from the impact on the workforce, right? If you're working and the whole time you're looking at your camera at home to make sure mom hasn't, started a fire
Yeah.
or is where she needs to be, you're not really productive, right? So there's absenteeism and there's
Yeah.
presenteeism. And I think that that's the piece where this is a larger solution for some of the, bigger problems that we have in the economy and in the world, right? Large businesses need to start investing in caring for their employees who are caregivers. I mean, that is what is happening. And so adult day they basically get to clock out. You drop your mom off at adult day. Now you get to go be
Yeah.
you and do the things you need to do and not worry about her.
Yeah, I think what you're saying is that you give that caregiver peace of mind, whether it's go to work or time to themselves, but you give them peace of mind,
Yeah.
which is pretty
Yeah.
awesome. I want to keep hearing more of your perspective. Where are the
Sure.
biggest operational pressures right now in adult day services? Staffing, reimbursement, access, or awareness?
Yes. All of the above, right? I think the
Well,
challenge, like
yeah,
the number one I have to, I would be remiss if I didn't mention, right, is, we have to protect Medicaid and HCBS services. HCBS, for those who don't know, stands for Home and Community Based Services. So those are services that are available to people so that they can continue to live at home, but still receive things like adult day, in-home care support and services, transportation. And so right now that is a, a concern, right? A huge concern for the industry. We need to protect Medicaid so that we can continue to have these services that are not costing exorbitant amounts of money, actually are saving the system money. Additionally, workforce is a big piece of it, right? No matter what we do, I mean, I love technology and I'm all about it, but people are at the core of our business. And we need to be able to provide fair and good wages to these individuals who are often women of color, often people who are still caregiving in their personal life as well. And so, they're being pulled at all different ends. And so I would really love to see, continued work in that area, as well as reimbursement. While I believe, adult day is, again, the least cost in terms of the system, it's still, reimbursement is not fully adequate. The adult day services that I've come in contact with continue to go above and beyond, and they'll go pick that person up even if there's not a payer for the day, and they continue to go above and beyond. And so I think we as a society need to invest in these type of services, because if you ask most people, it's what they want, right? Like if you ask me how I want to age at home. I want to be able to continue living in my home for as long as possible.
Where do you see breakdowns happening between hospitals, post-acute care, and community-based services? And how does that impact patient outcomes?
Yeah, I think like there's just an overwhelm of it, right? The system is overwhelmed. And so when, I was just kind of referring to an old program that I had helped create, a hospital transition program, where a care manager would go to the hospital once the hospital identified somebody who would likely be readmitted the moment that they went home, because people don't go to the hospital usually planned. So they're going and they get back to their home and there's no food in the refrigerator. The laundry isn't done. They have, their house is maybe not set up to accommodate their new mobility issues. And so adult day can play a big role in that, with, helping that person have a safe place to go during the day. But I think there's lots of opportunity. Discharge planners, physicians, healthcare people on the front lines need to understand that it's a combination of solutions, right? Like one piece of it is not the solution by itself. We definitely have to work together in order to meet the needs of people. And I think it begins at the hospital level for a lot of people, not all people, but a lot of people end up in crisis. They end up in the emergency room. And then what?
Yeah. What are the biggest misconceptions policymakers or healthcare leaders still have about the value of adult day services?
I will say, not to oversimplify it, but I think realistically, from my point of view, it's that adult day is a fringe benefit and it needs to be a core benefit, right? It's always been sort of on the peripheral here. And it's like, again, it's nice to have and it's available, but it's not, there's barriers to accessing it. So they're not in every community. They're not necessarily, transportation isn't easy to get to. So I think if we move that from being a fringe service into a core service and create a pathway for that to, again, from those discharge planners in hospitals, for care managers, referrals, things like that, where people are driven. Boy, words are hard. Where we drive business to adult days, in order to really utilize the services. So we have to stop being a peripheral and become a core part of the care continuum.
I wonder also if it's more reactionary than proactive. And
you're so right.
Saying needs to be standardized as integral part of total care.
We wait till a crisis happens. In all of my years of doing this, I think I've had maybe 3, and I'm being generous when I say 3, people come and check out adult day before they needed it. People aren't saying, hey, I want to create a solution. I know eventually I'm going to need this. And I think the other piece is we all avoid this idea that we're aging, right? That's happening to someone else. That's not me. I'm not aging. We are all aging. And frankly, it sure beats the alternative, right? Like, I want to be aging. If I'm not aging, then I'm not existing. So we have to stop hiding from that and fearing that. Instead, like, be proactive, figure out what your plan is, talk to your family, talk to your friends, say, this is what I'm going to want, and know what those solutions are before you're reactionary in chaos. And now you're behind before you even start.
Where do you see innovation having the most impact in aging services in the future?
I really do think technology is going to be a big piece of it, right? Like, some of the amazing things that are coming, wearable devices, so that you can have a health monitoring right on your body. robots in your home to wake you up in the morning and remind you to take your pills. Like there's such great innovation coming. I don't think any of it's going to replace people. Like I really don't. I think the human piece of it will always be there. But let's work
We hope
smarter,
so,
not
right?
harder. You know? I mean,
Yeah.
well, I'm gonna live by that feeling at this moment because the rest of it just scares me too much. But I think again, the more we can coordinate our services and collaborate and create an integrated model, the better we will be.
Can you expand on that a little bit? That integrated model. What does integrated aging care look like between hospitals, families, and community-based providers?
Yeah, I think that it is as simple and as hard as communication most of the time. Having a platform or having that information all
Sounds
in one
easy, right?
place sounds easy.
Yeah.
It's not, and we all know it. But I'm excited, and I think I'm energized by some of the platforms that are coming. I meet with somebody once a week who has developed an app or a program that you can, as a caregiver, you can have access to your person's list, and then you can share that with your adult day center. You can share that with your sister who lives in Kentucky. You have that ability to kind of streamline that communication, and then also eventually, right, like add those additional services. I will always and forever believe adult day is a huge piece of the puzzle, but it's not the only piece. We need the other home and community-based services. We need the other supports in order to be able to really holistically care for a person. So I think best practice is you have a care manager at the center of what you're doing, and they help coordinate that for the family. Maybe it's somebody who lives out of state. You can be a caregiver from across the country if you have boots on the ground supports. You can, utilize these additional services, in-home care, non-medical transportation, physical therapy, occupational therapy, nutrition, dietitians. If you have that wraparound, I think that the ability to maintain aging in place, like most of us want, becomes a lot easier.
Yeah. I don't have any statistics in front of me, but I believe the older population is one of the largest, or maybe one of the largest segments of our total population. How does that impact the work that you do, and what maybe are there some things that maybe the people outside your specialty are not anticipating?
It's funny because I think yeah, we've been talking about this at least, I think, for 10 years, right? The baby boomers, and, how many people per day are turning 65. And at the end of the day, there is no shortage in terms of, people that will need our services. There is no shortage of people who will be in the caregiving space and then eventually probably need our services, right? And so I think that the opportunity is there. And I think we can look at it one of two ways. I mean, some people refer to it as the silver tsunami. And to me, that just puts a negative spin on it, right? And I don't love that. I think the piece of it that we're missing is this is our opportunity. This is our opportunity to redefine how we age. This is our opportunity to rewrite what we thought it was going to be, because here we are. There are more of us than ever. We have less resources than we need and would like, and so time to get creative and time to really utilize. I think there's some brilliant people in the space, and I have hope. As hard as it is some days I don't watch the news because it is really
Smart
difficult,
lady.
but I can't handle it. But at the end of the day, like,
Yeah.
I do have hope for the people that I meet every day who are really committed to finding that little corner of the world and making it better. Right. And I think that will continue. And maybe I'm just having a super positive day, but I just think it's a choice, right? To look at it as an opportunity or a challenge. And I'm looking at it as opportunity.
I love it. I love that attitude, and hopefully, we choose to have better days. By perspective, right? Half full, half empty. I like what you're saying. Last question, and you've kind of threaded this throughout our conversation today, but do you have an underlying purpose or mission that overlaps with the work that you do?
Yeah, I do. And I think for me, it's twofold. It's really to provide connection and meaning for people as they age, whether that's someone living with Alzheimer's or someone living with a disability. We all deserve to have connection and purpose throughout our lives. And I think that often the older population or the people living with disabilities, they just get pushed aside as a burden. And I think like there's so much that we can learn from them. There's so much that they still have to give, truly give. And I think that we're missing the boat when we assume they don't. Second is the caregiver side of it. There are caregivers in every facet of your life. If you don't know a caregiver, you are a caregiver, or you will know a caregiver. At the end of the day, we have to take care of each other. and so for me, I think that's the driving force, is to educate people, to help them find the resources that they need, so that in those tough moments when we're all feeling it, you have a little bit of hope and you go, it's okay, because I get to tomorrow, I'm going to my day program. I'm gonna, even if you don't necessarily, like if you're living with dementia, you may not necessarily have that cognitive thought that, oh, tomorrow I'm going to my day program. But once you're there, you feel good. You feel like you've been seen. You feel like you've had a agency within your life and purpose within your day. And the caregiver gets to take that first breath of the day where they're like, oh, okay, I can do this again because I got some help. So that's my driving force always.
I love it. I love it. Thanks so much for spending some time with me today, Tia. This topic is really important to me. My mom was a 40-year geriatric nurse, and I grew up really close to my grandparents, and my grandfather lived with us after Nana died. And I really appreciate the work that you do and the care that you're providing for your community and getting the message out of adult day services. So thank you so much.
Oh, thank you for having me. I'm thrilled to be here. And, I love having conversations with like-minded people. It reminds us why we're here. So I appreciate it.
Yeah, of course. Where can our audience, where can our listeners go to learn more about NADSA?
Yeah, it's pretty simple. It's NADSA.org. So NADSA.org. That's our website. And you can learn about our work that we do. There's a locator. So if you're needing an adult day center in your area, you click on the locator and put in your zip code in your city and find a local adult day center. If you're a day center provider and you need resources, there's lots of resources on that website as well.
Awesome. Thank you so much, Tia. Best of luck to you in the year ahead, and wish you continued success.
Thank you. Same to you, Phil. Take care.
All right. Thanks for joining us for another episode of the Healthcast. Stay tuned for more. Thanks for listening to the Healthcast. If you enjoyed this episode, please like, follow, and subscribe, and share it with someone in healthcare or digital health. And if you're a healthcare leader focused on scaling your business or improving operations, I'm always open to connecting. You can find me on LinkedIn. There's a link in the show notes. Thanks so much.